The broadcast is now starting. All attendees are in listen-only mode.
Good evening, and thank you for joining us. I'd like to welcome you to tonight's program, Brave New World, a quick start guide to implementing teledentistry today, presented by Dr. Miles Cone and Cornelia Cone. Dr. Cone and Cornelia Cone will be speaking for about 45 minutes to 50 minutes tonight, followed by a Q&A session. You may type any questions or comments you have for them or for myself, the webinar moderator, in the questions box if you're on a control panel, or if you're on a cell phone, you can click the question mark button at the top of your screen. This program is eligible for 1 CE credit, and instructions for obtaining your certificate of attendance will be emailed to everyone tonight after the program. You'll be directed to our website to take a quick quiz. From there, you'll be able to download your certificate of attendance. This webinar is being recorded, and the replay will be available by Friday at the very, very latest on catapulteducation.com, probably within the next 48 hours, though. Your audio is muted tonight, and your webinar, as an attendee, your webinar camera will not be on, so we will not be able to see you or hear you tonight. You'll just have your audio. I would like to give a very warm welcome to Dr. Miles Cone, and I will now hand it over to him. We hope you enjoy the presentation.
All right, thank you very much for the introduction, Lisa. Hey, thank you for everybody that is attending our webinar. We're really excited to be talking about this topic. Cornelia and I have discussed this topic a little bit in the past. We've had a great reception to it, and it's amazing how many people are interested in this topic. And it's unfortunate that it took something like COVID-19 to get everybody really sort of, to get their interest really peaked in this, but here we are, and we are going to try to break down for you in the next 45 minutes everything that you need to know about teledentistry to get you up and running. So, current day, oh my gosh, end of the world. That's what it seems like, right? And for maybe some people it is, but I want to, we kind of want to provide a little bit of emotional support for you and let you know that we firmly believe that everything is going to be just fine. Things might not go back to the way they were exactly, but that shouldn't worry you too much. Anytime something like this happens, there's always three things tied to sort of a catastrophic event. There's a known known, there's a known unknown, and there's unknown unknown. So what does that mean? All right, well, the known known, we know that elective dentistry is indefinitely on hold for most people. And in some areas of the country, it is returned. Here in Maine, we were just given the order a few days ago from the Maine Dental Board that we now need to wait until essentially 1 June to begin. We are allowed to see emergencies only, but everything else has to wait, unfortunately. And, that's not a guarantee. And, a big part of why this happened is if you take a look at the top 47 jobs, and this was a study that was put out by Business Insider, and maybe many of you have seen this. If you take a look at the top 47 and then narrow that down to the top 7, take a look here. What do we see? Well, I'm a prosthodontist, so I'm at number 7. I also do some dental assisting. I am also a certified dental technician, so there's me at number 4 again. And I do my own hygiene, so I pretty much tick all of these boxes. So there's a lot of reasons why we shouldn't, return quite to the same place where we were before this started. So one of the known unknowns is that, the known is that people are still going to get crowns, people are still going to get implants, people are still going to get dentures, root canals. They're going to still get a lot of the elective dentistry. Obviously, they're getting the emergency type procedures that many of you have probably been doing already. The thing is we just don't know exactly when. And even though, like I said, even though our state boards put out dates for us, it's almost like for women who go into labor or something, right? Whatever that due date is it's a window, and we really don't know. We really don't know. And this has even more uncertainty, which is why people get a little freaked out about it. And at the very end, we have our unknown unknown. I think this is what scares people the most, is because we don't know how dentistry will change, and we don't know what exactly it's going to look like. But based on our predictions, that's what this webinar is really all about. And we're going to go through that with you guys today about what we think the future holds. And like I said, when catastrophe strikes, I think Going back through deep time, and this is something that's very near and dear to my heart because I was a paleontologist before I was a prosthodontist. Through all remembered time, there's opportunity. And you can view that. You can be a glass half empty or a glass half full type individual. And we're sort of a glass half full. We see the silver lining and we see the opportunity here. And for us, that opportunity is teledentistry. And I know up until maybe a month and a half ago, many people didn't know what teledentistry was. So this is the point where I'll turn it over to Cornelia, and she'll get into a lot of the real nitty gritty with you guys and telling you all the things that you really need to know about teledentistry.
Yeah, so good evening. So teledentistry, right? That's a word that you guys are probably a little bit more familiar now, but probably had never really heard of or thought about before this pandemic. So I usually like to frame things just with a good definition so we can get a handle on what this is. So in terms of teledentistry, what we are really looking at is using technology to provide patients with services and to pretty much make the distance between the clinician and the patient non-existent. We use it to bridge that distance. And there's been such advances in technology, and this is something that really wasn't always possible, but we're fortunate enough that technology is caught up and developed in such a way that this is something that we really can do now. So in terms of teledentistry, there's different formats, and the two that we are really going to concentrate on most as it pertains to dentistry is the live or synchronous encounters, and then the store and forward or the asynchronous, with the focus really being on that first one, the synchronous encounters. So the way that we think about how to implement teledentistry today is that there's really two objectives, right? We try to limit the office visits, and this is not just because we are limited in many states still only to emergency services, but even if you do have the green light from your state to go ahead with those more elective services, we try to keep those office visits to a minimum. If you really don't need to have the patient in the practice there and do all of the sterilization and infection control that goes along with a patient appointment now in the kind of pandemic era, and you don't need to don all of that PPE, then teledentistry is really a great option to limit office visits. And then also, of course, we use it as a screening tool. We have a standard checklist that we do with patients, but we also incorporate teledentistry when we do that initial screening for our patients before we actually schedule an in-office visit for them, whether that's for elective dentistry or for emergencies, depending on what you can do right now. So there's a couple of reasons to really pay attention to teledentistry now. And the first for us is really that it's a civic duty, right? If we can screen patients, give them good professional advice, and we can do it without exposing the clinicians and the staff unneeded, and we can also keep patients out of the emergency rooms, then that's really a win for the entire community. And then there's also another reason, which is there is going to be life after COVID-19. We can now think about how do we implement teledentistry right now, and then how do we make it transition into the after COVID era, and how do we use that as a useful tool then once we've figured out all of the kinks of how to implement it into our practices right now. So to that end, we have come up kind of with a quick start guide, and the idea is not for us to get into all of the different complex aspects of teledentistry, but rather to give you a checklist for things that will help you to navigate and get you up and running very quickly. So the things that we consider here is compliance, of course, is number one, malpractice insurance, aspects of coding, security, and really as it relates there to your patient's protected health information, and then also standard operating procedures. And I will go ahead and break that last point for you guys down even a little bit more. So when it comes to compliance, there are really two levels. And this is a question that we've gotten so many times. the question really is, to practice teledentistry, do I need a separate license for this? Are there specific state guidelines? And the answer to that is that the ADA has put out their policies and their position statement on teledentistry, and you can reference that. And the gist of that is that they would really like teledentistry to be just the policies developed, and it really should be controlled more on the state level. So the more important one of the two is to look at your state level guidance. And what we see there when it gets to state level regulations are that it's really an evolving landscape. And we started really doing these teledentistry webinars and giving people the quick start guide for getting up and running with teledentistry in the era of COVID-19 about a month and a half ago, right, Miles?
Yeah.
And since then, it has been amazing. States that really had no stated policy or any kind of guidelines on teledentistry has now stepped up and really given people who are licensed in that state some really good guidance in terms of that.
Yeah, I think New Mexico was one of those.
Yeah, so the way that it looks right now is pretty much every single state has some guidance there, and in pretty much every state you do have the green light to go ahead and do it. The two exceptions to that is Connecticut, where it's pending approval the last time we checked. And
as of a few days ago,
yeah,
about a week ago. Yeah, that
and
could have
then,
been changed.
Yeah, and then Texas, there's really some resistance, but the people are petitioning there to get teledentistry pushed through in Texas
and
as well.
if anybody here that's listening to this, if you guys have updates either on your state that you're in, or if you are in Texas or Connecticut and something changes, please shoot us an email at the end. We'll have our email up at the end. We'd love to know, and we'd love to pass that information along.
Because this is really just on an hour by hour, day by day basis, and I can attest to that here in Maine. Initially, they told us explicitly that it wasn't allowed, and then they pushed through and said now there's interim guidance, and then eventually they will get that legislation pushed through too. So the second one is malpractice insurance. And of course, the way that we think about malpractice insurance is this should be providing you with some kind of safety net. So once you have, if you think about this quick start guide almost as a decision tree, if you now check the box for, yes, I do have a good handle on what my state regulations are, I'm going to proceed. The next one that you're going to look at is, what does your malpractice insurance say? And here, there's a couple things that I would like to flag for you specifically, maybe good questions to ask them is, does my malpractice insurance cover only teledentistry during this pandemic? And then how would they define it and the pandemic period? And does it cover me to practice teledentistry across state lines if my state permits that? So that's another one, because your state might say it's fine to practice teledentistry in neighboring states, but your malpractice insurance does not cover it. And then also sometimes the malpractice insurance will say that they will only cover synchronous encounters, so not store and forward. So you would have to have a live video encounter with somebody. And so that's another thing that I would like you to specifically ask your malpractice insurance. So then further on, we would like to keep you safe and keep your patients' security, their personal protected health information secure. So there is a very helpful website at the bottom there that will help you navigate around this. But generally, what we can say is that HIPAA has really relaxed a lot of their rules around this to make it easier for people to practice teledentistry. This does not mean that there's no liability associated with it at all. You might still be liable at the state level, and you need to make sure that your malpractice insurance does cover this. So that if you have the green light there, then the guidance that we would like to provide you is that the ADA is also saying that there's two broad categories of platforms that you can use. The ones that you should absolutely stay clear of are these public-facing platforms. So those are the ones like Facebook Live, Twitch, and TikTok. And the ones that fall kind of in the gray area. We do not advocate that this is the best practices, but it is a way to kind of dip your toe into teledentistry without any cost associated with it. So these are free platforms for the most part, and those are the non-public facing ones. And a lot of these are end-to-end encrypted too. So there's a list of those, and you can take a look at those and see if any of those are an option for your practice. The ones that we do recommend are the more secure platforms, which you would have to, there's a fee associated with those. And the questions that I would like you to consider when you choose a platform is, number one, the security, right? How secure does this platform keep my patient information? And then the second one would be ease of use. Of course, this is something that's a little bit new to patients, so there might be a little bit of hesitation initially to use it. So the easier you can make it for them, and if it's something that doesn't need to get downloaded onto their computer or their cell phone and is simply opened by a link, and that gives them access to that live video conference, those are just, it has a little bit more ease of usability for your patients. And then the third one is, how does this platform deal with documentation? You might run into a lot of trouble if you would like to submit this for reimbursement to dental insurance carriers, and documentation and really capturing a video recording of that live synchronous encounter and all of the notes associated with it. And if you can even get a platform that has the consent forms integrated into that, that is really going to help you when it gets to the reimbursement front. And then also just to keep you safe and have your clinical notes, just all the T's crossed and the I's dotted. So some examples that we have here of platforms, these, and this is also something that is just constantly, every time we look, there's another platform. So these were the three predominant ones when we first started giving this. I know that Henry Schein has now since developed some, and there's really a myriad of options here. And they're not all created equally. Some have different bells and whistles. So if you consider those three questions that I said, the security, the ease of use, and the documentation, then you can find something that will be just the right fit for your practice. So how do you code for this? And here there are, the ADA has developed two specific teledentistry codes, the one for the synchronous and the other one for the asynchronous encounters, but these usually don't get used alone. And you typically need to use them in conjunction with another code. So the one that you are going to use most frequently is probably the top one there, that's 0140, the limited oral evaluation. And if you look at the website at the very top there, that is where you are going to get the best guidance. What the ADA has done, and this is something that they constantly update too, is they've really gone through every single dental insurance carrier, and they give you really, really detailed information on whether that dental insurance carrier does cover teledentistry, how they would like you to code, what kind of supporting documentation you need to provide, also whether this is something that they only cover. I know that there are some, in some states, some of these carriers will say, oh, we will only cover these teledentistry codes for a period of 90 days. So you need to look at those time frame limitations as well. And the best resource that I can offer to you to really help you navigate exactly how to code for specific insurance is that website at the very top, and that gets updated by the American Dental Association constantly. So then in terms of standard operating procedures, this is again something where you really need to consider your specific practice and how you want to do things. And here I can offer some suggestions for things to consider, and then you can, having answered those questions, you can then tailor how you're going to roll out teledentistry in your practice. So we look at who you will treat, the types of treatments, scheduling, of course, forms and specifically consent forms, and then also how you would deal with payment. So the real question here is, will you treat only existing patients? And some of your state regulations might limit you only to existing patients. Or will you also use this as a way of helping new patients? So a lot of people have also thought about this. If you do treat new patients, this could be a big practice builder for you as well. If patients are hesitant to actually go out and see providers, you can be a very, very helpful resource through teledentistry for them during a time where they might not get any other access to a professional opinion. And then you need to think about, how will I introduce this to my patients? So what I would say is, if you are going to roll out to existing patients, and even if you do want to use it as a practice builder to attract new patients, is to really mention this in all of your patient communication channels and put it on Facebook and let people know that this is a service that you are offering. And we also, what I will offer to you is, a lot of people have asked us whether this is something that patients will really adopt and whether we think this is something that they would find useful. So if you look at some of the research that was put out by the American Teledentistry Association, what they're saying is that in a survey, 70% of patients are comfortable with communicating with their healthcare providers, either via text, email, or video, in lieu of seeing them in person. So that's really reassuring, and I think that patients will probably have a much higher comfort level with this means of providing them with opinions than we might think. And then also 76% of patients will prioritize access to care over the need for face-to-face interaction. So if you can give them a good opinion, especially if you're limited to emergency care right now, you can provide a very useful service to patients. And then 30% of patients already use some kind of form of computer or a mobile device to check for medical and diagnostic information. And we know this, the first thing our patients do when they feel an ache or some kind of discomfort is they start Googling it. So if you can let patients know that this is something you offer, I think that you will find that patients will be very receptive to this as an option. So the procedures, there's only so much that you can do, right, with teledentistry. And I will say that I don't think it's reasonable to think that you can do a comprehensive evaluation for a patient over some kind of synchronous means of teledentistry. This is really, I think, very helpful. There's a couple things that I think it could really do very well. Is you can use it to triage your patients, right? You can do it for prescriptions, to give them a good opinion, possibly give them a referral if there's something. You can use it for those screenings, to have a discussion with them even before you do decide to get them into your practice. And then something that is something that we can roll out even beyond this period where we might be limited to only emergency procedures. And this was a really good point that Dr. Lou Graham brought up in a recent town hall meeting that we had, is that I think, and I agree with him, the point that he made was that teledentistry might end up completely replacing those post-operative eval appointments, right? Those what we kind of colloquially call the kind of quick look-see appointments, or those check-in appointments. You can save all of that PPE, all of the time and the hassle. If your patient needs to commute to get to your actual physical office space, all of that really is not necessary. You can provide your patient, you can even do multiple of those post-operative check-in appointments and provide them with even a higher level of service than you did before, and do it all through teledentistry, and then have it neatly documented and put all of those into your clinical notes. So I think that's really where this is going to become very, very important. And so again, these are just kind of the limitations that in many states we still have for the emergencies, but there is a role for teledentistry to play here. So the next thing we think about is how do you, so if you are going to use teledentistry, and now you've got a patient at home, and we've all encountered this, right? Patients send you photos, or you do that live video with them, but it's useless because you can't see anything, especially, and it's always, I think the majority of the emergency appointments we've had, right, Miles, has been molars. So it's way in the back. And now you need to try and give the patient a useful opinion on what is really going on with that tooth. But it's so difficult to see because it's so far back. And the challenge, right, really here is the light, right? You've got a dark cavernous space and it's just not adequately illuminated. So there's some tips and tricks, and I think Miles can go over some of these. And we've really developed this. We've kind of, through trial and error, done this at home. And we've also, some of these tips you'll see, we actually send a little diagram to our patients now. And I am very, very impressed with the quality of video and the pictures that we are getting. Just a few simple tweaks can actually, these are really, really good images and videos that we are getting from our patients. So we would like to share that with you. And I think this will be really useful to make this, take it from kind of like a B grade tool to an A+ tool.
Yeah, so like Cornelia said, the photos that we've been getting, and I developed this, and I apologize for my graphics ahead of time. I'm not a graphic designer or anything, but we just gave this little tool. It's like 1 or 2 slides. We've sent this to our patients, and the quality of the photos that comes in, it's so diagnostic. It's like unbelievable, and it has really saved us a ton of time. And again, like I said, I've been very, very impressed. So patient's going to send you some blurry, just nebulous photo that's essentially just going to clog up your inbox, right? So what you're going to do is you're going to send the patient this little diagram. It's easy, it's low, you know, it's not a large file size or anything. So the patient's essentially standing there, and you're going to have them open, and then all you need is like a little flashlight or a headlamp or something like that, right? You essentially need to illuminate the dark oral cavity. So like Cornelia said, I think 10 out of 10 patients that are contacting us, it's a molar. So we went in today for an emergency, and guess what? It was tooth number 18, right? It was a second molar, lower second molar. So patient comes in and you say, all right, you're gonna get a flashlight. So let's assume that you wanna get a shot of, say, tooth number 30 or 31, lower right quadrant. So if you're in Canada, and I guess that would be like 4-7 or something like that, 4-6, 4-7. In America, 30, 31. So you're going to want to position the flashlight on the contralateral side, on the opposite side of the head from where the problem is, okay? And if it's on the lower, then you're going to position the flashlight up maybe about eye level, sort of coming in from the side. And now this helps greatly if the patient has like a friend or somebody at home with them, a family member that's sheltering in place with them. Obviously, this presents difficulties if you're trying to take a selfie. But either way, so you essentially put the phone up sort of kind of at a slight angle, but essentially in front of the quadrant that you want. You take a photo, and this is a result of one that we got. And thank you, Cornelia, for letting me take a photo of your tooth and present it to the world. So,
and I want to say, so we're using this as an example for how to take a static photo, which I would also recommend, even if you are doing a video call with a patient, have them take a few still photos as well. It's nice to add that to your notes. But you can, same kind of principle applies if you are doing this with a live video chat. And they can simply, we've tried different things, a spoon, and really the base thing is a finger.
Yeah.
To just retract that cheek on the side there.
Make sure they wash their hands first.
Yes, of course. And that's the kind of image you can get. And I think that's pretty good.
It's not, yeah, it's not bad. I think that was like the first one. I thought, okay, that looks pretty good. And so, and like I said, most of the patients that are calling us, actually all the patients that are calling us are from molars. And I'll say there's at least 30%, probably 30, 35% of the patients that call us, surprisingly, it's a wisdom tooth that is completely bombed out. And there's no way I'm going in for that. Again, I'm a prosthodontist. I don't take teeth out. I don't do root canals. Like, there's no way. I'm not doing that kind of stuff. And now we keep this patient out of the ER, and I give them a referral. I just send them the referral form for the oral surgeon that I know. Like, hey, you're not getting a filling. You're getting that tooth out. It's a totally like rotted out number 32 or 16 or something. And that's been, yeah, probably a third of the patients that I'm like, hey, you don't need to come see me. You don't need to pay me for an expensive consult in the office. Just go see this guy, and they'll square you away. And they're super grateful for that. And we get many patients, the patients that we've seen so far, called us out of the blue because their dentist wasn't available. And guess what? There are patients now. They're coming to us because we were available. All right. So I'm just saying, like, even on like at the front end, if you're not making money generally just from the referral in and of itself, which many people you can get compensated for, trust me, the long-term gains from a patient of record, even if they only do cleanings at your office over a lifetime, I mean, that's like 25 grand worth of just cleanings and exams. So just consider that, consider the long-term gain. All right, so now what if you want to do a photograph of the upper teeth? Okay, same exact thing. Okay, so let's say it was the upper right quadrant now, right? So you're going to position the flashlight contralateral side of the head, down shoulder level, right? So you want to kind of coming up and at an angle. Shine the light in there, position the phone, kind of up and at an angle, take the photo, and then there's the upper tooth. And again, not bad. There's plenty of light in there. I can see everything that I need to, even back to the second molar, fairly well. And again, I could have positioned this in a few different ways, to get like a better shot, but again, not bad considering most of the stuff we see is super grainy and dark and cavernous and makes no sense. So I'll let Cornelia go back to discussing scheduling the patients. And if you guys are interested, if you guys want that graphic, again, shoot us an email at the end of this and we'll get that out to you guys.
Yeah. So the next step here, when you are considering your standard operating procedures, is of course going to be scheduling the patient. So this is really, it's going to be different for every practice, right? And a lot of it is going to be dictated by your practice management software and then also the staff that you have. So our practice management software is all cloud-based. We actually have set up our entire practice to be able to, we can run it remotely, and our, front desk, our receptionist, she's out in California, and we have it all set up like that. So for us to make this transition is really, it's very easy to implement it. So you need to think about how you can adapt the actual protocols that you have in your practice now, and just with a little bit of tweaking, how you can use those and then roll that out for teledentistry. And also think about little things like how you're going to deal with these appointment reminders, and how are the patients going to actually have to, how you're going to adapt your schedule and your template on your schedule and all of those kinds of things. So that, of course, is going to be all specific to your practice, but you could probably use a lot of the protocol that you already have in place. So consent forms, this is actually what was recommended by the American Teledentistry, or the ADA put this out. And this is something that you can just, again, adapt a little bit. It's really boilerplate language, but we do recommend that you do use a consent form. And some of these platforms actually have consent forms integrated into them as well. Then the big question, right? This is what everybody wants to know more than anything. Well, this is great. I think my patients could benefit. I could be of service to my patients, but can I make money off of this? So, like I said, there are codes, and a lot of the insurance companies will reimburse you for this. You do need to think about, when you do that coding, are you doing a good job with actually coding it correctly so that those don't constantly bounce back, and use that ADA guidance there? And then also, can you demonstrate medical necessity? And do you have the right documentation? All of those things, if you're buttoned up there, you're going to have a much better chance of getting reimbursed. But that being said, what we are seeing now in feedback is that really the reimbursement for those are more or less in line with what your insurance would have covered for a limited intraoral evaluation. And so for some of those could be $20 to $40. So when you are allocating time in your schedule for these teledentistry consultations, keep that in mind as well, right? Tailor the amount of time that you devote to something like this, and you can actually give somebody a really good opinion, some peace of mind, some comfort, and potentially a referral, or schedule them in your own practice, or give them a prescription in a very short amount of time. You can get a lot done, and you can really see what's going on there. So you could keep those limited and then make it worth your while. And then, of course, it's another story if you are a fee-for-service practice like ours is. But again, more or less what you would have done for a limited intraoral evaluation. But then more than that, we would implore you to not just think about teledentistry that in such a myopic way, right? It's not just for, oh, can I get $20 versus $40 or $100 for this synchronous encounter? What we are seeing for the most part is that this is really a great practice builder. And if you think about the amount of time saved and manpower and PPE, this is actually, I think this is really something to consider. And then even beyond, when we are kind of limited in the scope of our practice, I think that this is great for that follow-up appointment, right? You can save so much time on every front with this. So I think that this is something that we need to think about a lot wider and a lot more long-term. So always when we do this, and this is what we are saying, you know, you can work out the kinks for teledentistry, get yourself up and running, but what is this going to look like after this is over and we return to some kind of sense of normal practice? And we have some thoughts for you on how you can keep on implementing teledentistry and what this would look like in your practice beyond COVID-19. So I'm going to turn this over to Miles, and he's going to show you some options here.
Okay, so obviously, right, with COVID, there's the social distancing aspect, right? But there's so many other things that teledentistry is going to be good for. So, for example, in Maine, one of the big things are the underserved communities. In Maine, there's Portland, right, where our office is, and then the rest of Maine is moose country, right? So there's a lot of people that have need. And also a lot of these people have lack of transportation, or because, you know, I'm a prosthodontist and Maine has the oldest demographic in the country, a lot of these people don't drive, right? So getting to our location is difficult sometimes for many of these people. Some of them live in nursing homes, right? So teledentistry is going to be very instrumental in making sure and following up with these people and making sure that they're healthy on a day-to-day basis. Also, we have a lot of dental phobics, right? People who have put off dentistry their whole life, and now they're probably in need of a full mouth rehabilitation, and they don't know what that's going to look like. So this is almost like, you know, kind of easing them into the process a little bit. Also, there's a lot of universities here, a lot of people who work. So taking time off from work and school is difficult sometimes. So that opens it up to a lot more people. And then like what we're doing now, continuing education, that's going to be huge going into the future, right? Zoom, all of these companies that are in tech are making tons of money because they realize that this is going to be a big thing going forward. Also, the peer-reviewed journals all indicate that teledentistry has been so ubiquitously successful, whether it's in prost, my specialty, right, ortho, endo, perio, also the laboratory communication, right? I'm a technician as well, and the technicians I work with, many of them are around the world using teledentistry videos. This sort of synchronous and asynchronous capabilities helps with that communication process and the collaboration to have really, really good outcomes. Now, one of the issues with teledentistry in the past was, right, if you had a DSLR camera or an SLR camera, right, some sort of means to photograph these patients, how did you get that to somebody that you were collaborating with, either another specialist, a colleague, a laboratory, whatever it was, right? How did you do that? Well, the process of taking a photo, and if you had to develop the film, then it was actually pretty much forget about it. But now many people are already doing this asynchronous, this what we call the store and forward. You're already taking photos, downloading it to the computer, and then sending it via email, right? So that's still kind of a problem though, especially with people who have cell phones, right? Like what we described before, the big issue was illuminating the inside of the oral cavity. Well, if you had a big flash on your camera, that wasn't, that's not a problem. But so what do you do if you have a cell phone? Well, if there's a need, you can guarantee that somebody's gonna, step up to the plate and develop a solution for that. And there are solutions for that. So many companies have developed these products that Cornelia and I have termed Eels, which is an external artificial light source. And we've written a few papers on this. This was in Inside Dentistry about a year ago, and also Inside Dental Technology. Aegis Publishing liked the article so much that they published it in both of their sister magazines. So if you guys don't have access to those magazines and you'd like to learn more about this, please, by all means, reach out to us at the end of this. We'll have our website, our photography website available at the end. You can log on and download the articles. They're all free, and it explains more about this in detail. So for example, one of these products is the MDP. This is by Smileline, and this photo is just to give you reference so you can see how large this thing is compared to your cell phone. Super easy to use, and what I'm going to show you now, I want to qualify this. The images that you're going to see, these were all taken by Cornelia. So Cornelia is not an assistant, a dental assistant. Well, she is, but not by choice. Cornelia had, up until a few years ago when we opened our practice, Cornelia had no knowledge of dentistry other than, some of the photographs that I brought home and some of the discussions with my dental buddies about, ceramic and, titanium implants and things like that. So these were all real patients in our office that Cornelia took these photographs with these products right out of the box. So I think this is actually one of our lawyers or something like that.
Yeah. So I think what Miles is trying to say, pretty much anybody can do this.
Right.
If I can pick this up and out of the box take pictures, which
They're
you
pretty
can see,
decent.
yeah,
It's pretty
not
decent.
bad. So you can really get, anybody, a dentist can surely do this, and you can get your assistants up to speed with this.
Right. It's very
quickly.
easy to do. So that's the thing. So when you do get back into your office and patients aren't wanting to come in as much, this is an excellent product for nursing homes. It's an excellent product for remote dentists, right? If you're going to be in the field, I know a lot of folks go and do these missions in like Nicaragua and Africa and things like that, and these trips, where they're going and doing a lot of this kind of stuff. You can rapidly communicate with other people really, really fast. So this is a photograph. We had a fella come in, and he was interested in veneers. I was busy in the laboratory all day. It was my day off. Cornelia was doing, some patients in and out of the lab, getting some x-rays and things done. So I gave her this device and said, hey, go take some quick photos, bring it to me, show me. And this guy, I was like, oh yeah, this guy would be a good candidate for some veneers. This would be a really good case. This is our poor daughter. Cornelia took these photographs. This was at our house, at our kitchen table. I think this was before we ate dinner. My daughter's teeth are not normally this clean. So this is my daughter's teeth, and then we sent these over to the orthodontist, and they said, wow, these pictures are better than the photos that we take with our really expensive camera. This was a woman that came in. I think I might have even been, had just stepped out to go grab us lunch or something. This woman came in with some aching around these implants. This is a brand new patient. Cornelia took some photos and said, hey, what do we do with this woman? I said, oh my gosh, she needs to see a periodontist like really soon, or an oral surgeon. This is something, what am I going to do with this? I don't do surgeries and things like that. So, we sent these right over, took a little video, sent that over to our periodontist and got her squared away. And now, there's a lot of times where I've left my, my really hardcore camera at home, and I need to get really good shade photos, and I've taken excellent shade photographs with this. Again, communicating with the laboratory real time, saying, hey man, here's this final shade, make the veneers, make the crowns, whatever it is that you're doing, hope that's going to work out for you. And then now in this day and age, right, so the patient comes in and they need a consultation, they broke a tooth, they're in, a little bit of discomfort, and we take the photograph, and the other dentists across town can send this image to me and say, hey Miles, is this something you want to see? You think, since Prost drives to train with this, restorative dentist is ultimately making the decisions on this. Is this something you think we need a root canal on? Can we save this? This is tooth number 10. We're talking about the upper right lateral incisor here. And I'm like, no, we can do this. This is something we can handle in office. This isn't something that needs to be referred out. This was an actual patient that just came in a couple days ago into our office, and we took these photographs, and I took a look at it, took a look at the radiographs. This has got subgingival caries. I took a look at this radiograph. That's almost at the bone level, or at the bone level. And I, explained to the patient, hey man, this is a large restoration, subgingival. This is going to need at a minimum root canal, crown lengthening, core buildup crown. You're looking at, in Portland, Maine, you know, close to $5,000 to save a second molar. You can pay $5,000 to go see 3 different specialists, or you can go see one guy, oral surgeon. He'll take it out, and you'll save probably about $4,700, and you can go see the Galapagos tortoises when the COVID pandemic is gone. So she decided she wanted to see the turtles. we're not trying to save this tooth. So guys, here's what this article looks like. This is this article, Let There Be Light, that Cornelia and I wrote for Inside Dentistry, again, last year. Again, if you'd like this to read more about it, let me know. We're happy to send that over to you. And again, we'll have the website up at the very end. You can take a look at it.
Okay. So now this is the part of the webinar where we give you guys a little bit of a psychological pep talk, right? So Miles and I, the way that we like to think about it is that there's different zones that we're operating in, right? And so the same thing goes here for COVID-19, right? Which zone are you in? Are you in that fear zone where you're really just frantically making decisions, really not acting rationally, just acting out of fear? Or are you in the learning zone? And you can really start kind of like thinking and consuming information now. Or where you really optimally need to be is within this growth zone, right? You look for a way to adapt to new changes, right? And so the way that we think about teledentistry is that this is really falls within that growth zone, right? Can we learn some new skills and then think about how do we implement it and really adapt to these changes that we are facing? Then also, we kind of got, you know, sometimes you just need a little bit of a like humor just to lighten the mood a bit. And so this is something that circulated on social media, and the joke is that this is what dentists actually looked like around February of 2020, and then the picture on the right is April 2020.
May,
yeah, we're into May now, right? So we know that this is really a stressful time. We're all under a lot of pressure, and we really just need to keep level-headed and stay rational and make good strategic decisions, right? So if you think about that whole grief cycle, and this is kind of what we're going through, right? We hope that everybody is at least in this on the 6th.
Beyond the shock and the denial and anger.
And all of that stuff, right? Bargaining and depression. And then we're now at least in that phase where we're in the growth zone. We're going to test things. We're going to try and find realistic solutions to our problems. And we really hope that we could maybe make you think a little bit differently. And maybe teledentistry is one of those realistic solutions that you can implement now, get it up and running quickly, and then use it way after this whole pandemic has blown over. And you will never look back and think, gosh, how did we ever bring patients back for those re-evaluations and do all of those things? Like, that was such an inefficient way of doing things. So that is our hope for you today, and we hope we could make you just think a little bit, right?
Yeah, a little bit.
So thank you.
Yeah, thank you to everybody for showing up. Thank you for sticking around. Again, you please reach out to us. We really like talking about this topic. We really like talking about teeth in general. You don't have to talk to us just about teledentistry. You can reach us at our office email, which is admin@nuancedental.com. Our webpage, which is for photography, is www.depthofielddental.com. That has all of our papers on there. Again, you can follow me on Instagram as well. And if you guys are interested in this, I am a KOL, a key opinion leader for Smile Line. If the MDP, that device, that Eel that you use to take those photographs, if that is something that interests you now or in the future, please use this code down at the bottom. It's 20 and then the name Josie, and they'll give you a discount on that if you like. Guys, we would be happy to take any of your questions now. Again, thank you for sticking out and sharing the evening with us.
So I think those questions are going to come in right there in the chat section. So we'll just keep an eye on it. Let's see what we have there.
Okay.
So.
All right, so this is a question that says, how does teledentistry relate to dental hygienists? Are RDAs allowed to provide teledentistry to patients? That's an excellent, excellent question, Lisa. And as far as I know, now again, I'm a prosthodontist, but as far as I know, teledentistry has been widely available to hygienists. And in fact, this is where I think most dental offices are going to have the biggest impact, is on deploying hygienists to nursing homes and other facilities where they can take these photographs. And so, like, again, those eels that I showed you, that would be something that would be extremely beneficial that you can take with you. It's very portable. It doesn't require batteries or anything like that. And you take it along and you do these photographs and you have this synchronous encounter, right? The synchronous encounter, or combination of asynchronous, where you're taking the photographs of the patients at a remote site, and then you're sending it and bringing it back to the clinician that's there, showing them, and then making judgments based on this. And I think with RDHs, that's an excellent question, and I'm gonna steal that question, Lisa, and we're gonna put that in our next webinar. That is an outstanding question, actually. And like I said, RDHs, like the hygienists, I think are going to have some of the biggest impacts with teledentistry going forward. Absolutely.
Yeah, absolutely agree. And then again, the other thing that I will just mention, of course, there's going to be guidance and policy differences between states, right? Mm-hmm. And in certain states, there are even, I think that here in Maine as well, an RDH can actually have their own separate practice. The only provision then would be that at least once a year, they would have to have a dentist do that periodic evaluation. And that's something that we can definitely see a lot of room for teledentistry to come into play then.
Yeah.
So,
yeah, so here's another question. All right, this is, okay, so Elizabeth wants to know, what are some of the names of the eels? Okay, so the names of those eels, the one that we use in our office, now there's a lot of them, and it's the same thing with some of these teledentistry platforms, right? There's a lot of different ones. The one that we found is the most beneficial one. It's called the MDP. MDP, it's easy to remember because it stands for Mobile Dental Photography. And that's made by a company called Smile Line. And that's smile, like your smile, and then line, like you draw a line in the sand. And again, that, if you look on our webpage, Elizabeth, that we show down here, that is on the webpage. You could actually see the product on the webpage. Or again, the Smile Line logo is down there. You can check that out. And that's the one that, using that code, you'll get a discount on. Now, there are a few other ones. PhotoMed makes one, and I believe that's called the SDL, which is the, what is that? Smartphone dental light.
Yes.
Yes. And then there's another one by a company called CocoLux, which is it's a little bit smaller, and that's made by D Dental or Haas Dental Corp out of South Korea, I believe.
Yeah, and all of these, you know, we actually did kind of a comparison and just kind of went over some of the features and bells and whistles. They're all a little bit different. We have the most familiarity with the MDP, and we think that we've gotten really good photos with
best photos with that. Yeah.
But you know, they all come at a different price points, and there's some certain features that, you know, might appeal to you specifically. But those are some examples.
Yeah,
right?
and what we like to say is, I believe it's really the archer, not the arrow. with a little bit of practice, I think you'd be able to take pretty outstanding photos with any of them, to be honest.
Yeah, I know, but I guess I would counter that and say that if you're an inexperienced archer, it helps to have a good.
It does.
arrow,
Okay,
right?
true, very true. Okay, yeah. So thank you for your guys' questions. Okay, are there any other questions? Let's see. Okay, let's see. So here's a question about teledentistry's, or Henry Schein's teledentistry. As far as we know, I thought that they were up and running with that.
That's the notification. We haven't used it, and I did see that they were saying, you know, that is up and running.
So Henry Schein had a really nice option though, because last I heard from them, it was $50, like a one-time $50 fee. So if in your office you don't think you'll be using this that often, you pay $50 for it, and then I believe you pay $4 per encounter. Some of the other services, the other subscription services like ICE Help and Rhinogram, and you know, those are, I think you pay monthly for those.
Yeah, I would say though, you know, I guess in full disclosure, we haven't seen a demo, and we haven't used Henry Schein's platform, so I can't really speak to the functionality. I have gone through demonstrations of all of the other platforms, and ICE actually, for the price point that they are coming in now, and I think they're being distributed through Midway Dental, it's a really nice, very secure platform.
The ICE, yeah, the ICE platform, I think,
yeah.
is the standard for security. So if security, patient security is important to you, and it should be, I think the ICE one is pretty slick.
Yeah, and they have a lot of nice functionality to keep your documentation saved in there. They actually have an integrated practice management software.
And you don't need anything, like you don't need equipment, right? I mean, it's like just, it's ready and it's easy.
Yeah, so I guess if I could say, one of the platforms that for me ticks all of those boxes, in terms of security and then ease of use, because there's nothing you need to download. It basically sends the patient a little link, and then it just opens up that conference right there, the video conference, and then also the documentation. For me, ICE ticks all of those 3 boxes, and then as a bonus, it comes in at a pretty nice price point.
Yeah, and let us just clarify. I mean, we don't speak for ICE or anything like that, but
this is just our personal opinion.
Personal preference. Yeah. So I hope that helps. Okay, let's see. Any other questions? Okay, I think, if there's any more questions, we're happy to take those. We have a few more minutes. Again, if not, like I said, please check out the paper we wrote. Send us any of your questions offline if you have them. Take a snapshot or a screenshot of this final slide, and again, we'll be happy to communicate with you guys as best we can on the topic.
Yeah, and I really hope that we could give you guys some beneficial and useful information here, and at the very minimum, just kind of maybe have a little bit of a framework shift on how you could possibly implement teledentistry in your practice.
Yeah, and I think right now, especially on social media, if you guys are, hanging around social media constantly, get off of it. There's actually a lot of negativity out there, and I think that kind of negativity is contagious, right? And we're always seeing the silver lining, always seeing the glass half full. I think there's going to be a lot of opportunities coming from this, and I think the folks that stay upbeat, stay positive, and are ready for the challenges ahead are going to come out of this much better.
Yeah, so there's one more question that came in.
Oh, right. Yeah. So the ADA guidelines say that Google Hangouts and FaceTime are okay. So the Google Hangouts and the FaceTime, those are not public-facing apps.
It's a little bit more secure.
A little bit more secure. Yeah, they're free. And if you want to do those, I think that's okay. Some of the HIPAA regulations are being relaxed a little bit.
Yeah.
But again, if you want to be really secure, if it's me, and again, when I was in the military, HIPAA was like a big thing. There were always breaches, and they just beat this into us that, you don't want to get hit with like $1 million lawsuit or something because, I just, for the cost, I think something like some of these platforms, it's probably less than $100 a month. Honestly,
it's kind of a no-brainer. I think for the peace of mind. Now, I mean, of course, that's absolutely correct. The ADA does say there's a distinction. There's definitely certain platforms that they try to steer clear of some of these.
Steer clear of TikTok. Steer clear of, don't do TikTok. Don't do Facebook Live. I mean.
But those, like, then other ones, those that are non-public facing, that's kind of what we said before. They fall into that gray area. If you are going to use those, and of course it's a little bit more cost effective because some of those platforms are free. If you do feel comfortable with using that, I would just say when you are developing your standard operating procedures, really think about your consent form. Make sure that your patient signed that, so it gives you that extra little layer of protection. And then if you are thinking of claiming for this from the insurance companies, you need to have a nice protocol for how are you going to capture that, right? Some of these platforms make that kind of a no-brainer because they've thought through the entire protocol for you, but and it makes it easy to save and store securely. But if you are going to go that route, just really kind of think through the nitty-gritty details and the logistics of, okay, how am I going to actually save this? Because otherwise, if you go to claim and you have no record of the fact that you actually had that video conference with your patient, there was actually somebody on a social media forum that was saying he went through all of this trouble was so disheartened because he couldn't get any kind of
Claim from it,
reimbursement.
right.
And it's because it's like it never happened. You have no documentation
There's no
for
proof
that.
that ever happened.
So
Yeah.
I would just say, if you are going to go that route, really think through those two things, the documentation and then the consent forms as well.
Yeah. All right, let's see. Any last minute questions?
Is there another one?
Do we have an informed consent for teledentistry?
Yes, we have an example.
Yes, Jenny, we do.
So you can, of course, tailor this to your practice, but the one that kind of has boilerplate language there is the one that you can reference on the ADA's website that we gave as an example there. So that's going to give you some kind of blanket coverage, and if you then want to add something here or there, and then also if you do use a teledentistry platform, a lot of them have some really nice consent forms integrated into the platform as well. But otherwise, reference the one on the ADA's website.
Okay. Last minute questions. Going once, going twice. All right, so I think that might be just about it. Oh, no.
Oh,
no.
one.
No. Okay, Patty got one in. Yes.
Yes, yeah.
Yeah,
So
save the consult.
as much as possible information, right? So if you have the functionality, so I guess, let me just paraphrase here. We need to give the other listeners an idea. The question was, do you save the entire consult? Yes. The more documentation, especially if you're going to try to get reimbursed, if you have the option of recording that entire consultation, the video consultation, do that, save it securely. During that video consultation, if you can take some still photos, that's helpful as well. And again, that's something that's built into a lot of these platforms. You can do it with the other free platforms. It would just require a little bit of thinking on your part, and then just document. Not only for your own protection to minimize liability, but also if you want to get it reimbursed, right?
Yeah, imagine a patient coming in with pain on a tooth and you just submitted to insurance without an x-ray, without any, I mean, you wouldn't do that for, for everyday dentistry. So keep that, same protocol in place for teledentistry. Have photos, have documentation so that you can prove that, in fact, yes, this tooth had a very large cavity on there. Hey, I gave a consult, I prescribed some meds, I gave a referral, I did whatever, you know what I mean? And put that in your clinical notes and make sure that you submit that with your to the insurance claims. And I think you'll have no guarantees, but I think you'll have a much better chance of getting that reimbursed and getting some payment for that.
Yeah, and I think I would venture to say that this is probably even more important, right? When you are doing to adequately document, not only during the time of this pandemic, that's the one aspect of it, but then also if you're using kind of a newer technology like teledentistry, where they might be a little bit more weary of people just doing it, but then it didn't actually take place.
Correct.
Right?
Yep. Yeah. Okay, guys. I think that's our time for the evening. Again, thank you very, very much. And yeah, if you have further questions, please contact us offline. And thank you.
All right. I would like to thank everyone for attending tonight's program and for your attention. Instructions for taking your CE quiz and getting your certificate will be emailed to everyone in about 1 hour from now. So please keep an eye in your inbox. If you don't see it there, look in your spam or possibly even your social media folder. The webinar was recorded and the replay will be available probably within the next 48 hours, but definitely by Friday at the very latest on catapulteducation.com. Once again, I would like to give a very big thank you to Dr. Miles and Cornelia Cone for this presentation. We very much appreciate your time and the valuable information presented tonight. Have a great evening, everybody. Stay safe and take care.
Thank you.
Thank you.
Good night.